today we'll talk on more of myths. So many patients asking me a lot of myths regarding this. So I want answers for them. The first one is it women's fault to
Yeah,
get
yeah.
into
Yes,
cervical
yes. This is,
incompetency?
yeah, because many a times our patients come with their relatives and they say, oh, this lady didn't do this, lady didn't do that, she did not rest and all those things. Well, it is actually the women's fault, to be very frank, because they are the one who can carry the pregnancy. No, men can't carry, right? Men don't have uterus, men don't have cervix, so well, how they can have? But to be very straight on this, you as a woman or as a pregnant woman, they don't know what is happening inside the uterus, so they cannot predict it. One, and studies have shown very clearly that even with an absolute bed rest, this outcome cannot be prevented. If a bad outcome is going to happen, because you need to go to pass urine, you need to go and pass motion also, you need to at least go walk around for some time. That itself is enough to cause the incompetence. It's a very very big misconception that if you are taken an absolute bed rest, this outcome won't have happened. I also tell that even if your hand top leg up, still it would have happened even if you move for some time. So it is not a blame to be put, it is basically, it is a condition which needs a treatment. That's it.
Okay. If women age more than 35, 36 like that, is there any chances the women of older age can get the incompetency more? Is like that anything to
This
age?
is another thing which people keep saying, with increasing age, the incompetence also, or the cervix also will become more incompetent. Like any structure in our body or any organ in our body, aging is a process, but we have not seen any correlation like that, that anyone who is more than 35, 36 years, they are more likely to have incompetence, because as I said, it is more of a fibrous tissue, less muscle in it. So generally, the fibrous tissue don't degenerate like that, and there is no study which says that with increasing age, cervical incompetence also more common. No.
Ah. So, doctor, one more thing. The woman had first pregnancy, naturally, no any incompetence and all. When she conceived the second time, and if she got into the incompetency, they are asking why I'm getting in my second trimester or a second pregnancy when my first pregnancy was totally normal. Is there any correlation like first who didn't got any competency can get into?
So the thing is, we do think that if a first pregnancy is all normal, the second pregnancy could all should always be normal. Particularly if you have had a normal delivery, and if it's a traumatic normal delivery, then the cervix can tear. If the cervical tear has not been recognized or not been properly addressed during that pregnancy, then these patients are more likely to end up having a cervical incompetence. So history becomes very important. If the first pregnancy is a normal delivery and you had too much of bleeding during delivery, or there was some extra procedures done like vacuum, forceps, they are at increased risk of having a cervical incompetence. In that case also, we do the same procedure like measuring the cervical length and the pressure test. So it can happen following a normal delivery. So these were certain myths and treatment or diagnostic options for the cervical incontinence condition. We will be discussing about the treatment options in our next video. Please follow us.